Okay, have you ever noticed how we typically talk about health? We almost always measure it by what isn't there. The absence of a fever, the lack of a chronic disease, the elimination of a virus. It is an incredibly clinical, honestly, almost sterile way of looking at human existence. It really makes you wonder, is a healthy life actually just about dodging illness until the clock eventually runs out? But what if we completely flipped that on its head? Instead of this failing, hyperclinical view of just trying to eradicate disease, imagine a genuinely exciting new paradigm. Health is not just an empty space where a disease used to be. It's actually a cumulative, lifelong stock of well-being. It is something you build, something you grow, and something you actively invest in every single day. Welcome to today's Explainer, where we are going to unpack a truly revolutionary way of thinking about human well-being, the Health Capital Bank Account, and exactly how love builds health. Today, we're going to look at your health a lot like an investment portfolio. And as you'll see, the absolute most powerful currency you can deposit into this account isn't necessarily found in a pharmacy. It's actually found in human connection. Okay, let's dive into this with Section 1, Rethinking Our Definition of Health. Let's first examine the core problem with how we usually define our well-being. Contemporary discussions around public health and economic modeling are almost exclusively focused on high-tech interventions. The issue is, when health is framed purely through the lens of fixing what is already broken, it can feel incredibly fatalistic. We basically neglect the whole human. We end up turning people into data points, tracking illnesses rather than tracking actual human flourishing. Which brings us to Section 2, Enter the Health Capital Framework. So, how do we fix this? Well, the answer lies in a brilliant academic framework that changes the entire conversation. I want you to literally picture your well-being as a bank account, and hopefully one with a much better interest rate than your typical savings account. This is the Health Capital Framework, developed by Professor Wagner Marcenes. Under this model, health is a cumulative, lifelong stock of mental, social, and physical well-being. So every positive choice, every strong relationship, every single moment of mental clarity adds to your stock. You're constantly making deposits or taking withdrawals over the course of your entire life. And what's really fascinating here is the primary currency funding this account. We're so used to thinking the currency is just our genetics or our medical treatments, right? But under the Health Capital Framework, human well-being relies heavily on psychosocial determinants, your emotional states, and your social connections. Basically, your emotions are literally capital. Section 3, Love as the Ultimate Catalyst. If emotions are the capital, then we absolutely need to talk about the ultimate financial catalyst for this account, the single most powerful driver of them all. Love acts as a profound generator of positive emotions. It is universally understood, but it's so rarely applied to clinical health. The source material highlights that love has this completely unique capacity to alter human perception. When you experience love, and that can be for a person, a community, or honestly just life itself, it reshapes your reality. It actually enables you to perceive beauty, grace, and hope, even in environments that are marked by severe hardship, scarcity, or absence. And this perceptual shift is highly practical. Emotions like joy, warmth, and gratitude aren't just fleeting, warm and fuzzy feelings. They act as daily deposits into your health capital account. They actively build a massive internal emotional reserve over time. Because let's face it, life is full of daily stressors. Think of those stressors as taxes or, those random hidden fees constantly trying to drain your bank account. But love serves as a psychological anchor. The internal emotional reserve built by joy, warmth, and gratitude forms the core of your mental capital. It literally protects you against the psychological wear and tear and the sheer bleakness of those daily taxes. Moving right along to Section 4, Fueling Healthy Life Choices. Now, having a high balance of emotional capital is great, but let's look at the incredible return on investment this provides when it comes to our physical behaviors. When we face adversity, isolation, and material deprivation, it often fosters fatalism. When people feel isolated, they see very little reason to invest in their future health. It quite literally bankrupts their motivation, leading directly to self-neglect. But on the flip side, when individuals feel loved and emotionally secure, their capacity to adopt and sustain healthy behaviors increases dramatically. Emotional security actively disrupts that cycle of neglect. Let's actually walk through the exact progression of how feeling loved translates into physical health. Step 1 is motivation. Feeling valued provides intrinsic motivation. Self-care becomes an act of self-preservation, not just some tedious chore. Step 2 is resilience. Faced with health challenges, individuals who feel loved have the determination to persevere. And step 3 is a positive outlook. You are way more likely to engage in physical activity or, finally eat that broccoli you've been avoiding because you actually have the emotional capital and the optimism to do so.
It really boils down to this. When you have love, you naturally don't need to be forced to be healthy. This intrinsic motivation makes external compliance mechanisms, those punitive, guilt-tripping public health campaigns, entirely unnecessary. You take care of yourself because you inherently feel you are worth taking care of.
Section 5. Building strong mental pillars. To truly thrive under the Marcenes Health Capital framework, we have to establish robust mental states. And this brilliantly illustrates how the intangible feeling of love maps directly to concrete health outcomes. Self-esteem allows you to view yourself as inherently worthy of health and dignity. Mental strength acts as a psychological buffer, absorbing the shocks of life crises and preventing chronic stress from turning into actual physical illness. Together, these pillars lead to holistic flourishing, proving that emotional well-being is completely, 100% inseparable from actual physical longevity. Finally, Section 6, the public asset. If we understand that this works perfectly on an individual level, we really have to shift our perspective and look at the macro-level impact on society as a whole. Love is far more than a private sentiment. It is a powerful public health asset. Recognizing love as a core component of our health capital demands a completely new, humane approach to public health care. It calls for a relational approach that actually honors the emotional and social truths of human flourishing, rather than just treating us like broken machines on an assembly line. Which brings us to our final thought. The research is absolutely clear. Love builds health. It builds resilience, it builds motivation, and it builds physical longevity. So I want to leave you with this question to ponder. If love is a core pillar of our health, how are you investing in your emotional capital today? Are you making those daily deposits? Thank you so much for exploring this fascinating framework with me. Treat your relationships as the essential health investments they truly are, and I'll see you in the next explainer.